no question that many of our rheumatology appointments are just too short. I've experienced this myself as a patient when I notice the doctor inching towards the door, or as a doctor when I feel pressured to stay on time despite knowing my patient needs my full attention. There's tons of information on the internet about how to get the most out of your appointments, but today I'm going to be offering some perhaps unconventional ideas to squeeze as much as you can out of the 10 to 15 minutes you have with your doctor. Today we're going to get into how to get your questions answered and build a strong partnership with your doc so that you can make the most out of your visits. I'm Dr. Elizabeth Ortiz, and I'm excited to partner with AbbVie on this episode of Connected Rheumatology. Let's get started. Think about how you would prepare if you were meeting with a mechanic. You may not know everything about your car, how it works, or why it's making that funny noise, but you would show up to the meeting with questions and a clear idea of what you want from their service. In this scenario, most of us wouldn't question that the mechanic is the expert in cars in general, but you are definitely the expert in your car. You know what the noise sounds like, when it started, and what makes the noise worse. Honestly, your doctor's visits are no different. I see time and time again, people show up to their appointments assuming the doctor is going to run the show and they are just there to get instructions. But you both bring your own expertise to the appointment. So how do you do that? You set an agenda. First on the agenda, know your condition and the symptoms you are experiencing. It's simple and you may not think it needs to be said, but I'm saying it anyway because I have seen it too many times. When asked, "How are you?" patients respond with, "Fine," or "Where's your pain?" and the response is silence. This doesn't help you or your doctor understand how you are truly feeling. And remember, nothing is too small to make note of, and the more specific you can be, the better. By starting this dialogue, you will learn what symptoms are related to what issue and can begin to fine-tune your observation skills. After your symptoms, next on your agenda should be your questions. It can be up to 6 months between your appointments, so you are bound to come across questions you have for your doctor. Although it's true that it's difficult to address pages and pages of questions, you should be able to address your top 3. Have you come across some information on the internet you have questions about? Do you have questions about your future health as it relates to your condition? Have these written down and ready to go before you even walk into the clinic. And the final piece for your agenda is any needed paperwork. We can need forms filled out for any number of reasons, and knowing ahead of time what you need will save everyone time and headaches. So now that you have your agenda with your current symptoms, your questions, and any needed paperwork, I'm going to suggest something kind of radical. Consider sending your agenda to your doctor ahead of time. Listen, not every doctor is gonna love this. The number of messages we get is crazy. So it can seem like just another message to have to attend to. But if your doctor is open to it, sending your agenda ahead of time with a, "Hey, looking forward to seeing you at our next visit next week. These are the items I'd like to discuss," can give your doctor a heads up and allow them to allocate enough time to get to everything on your and their list. Have you heard of the Yogi Berra quote, "If you don't know where you're going, you'll end up someplace else"? Wise words and applicable in so many situations, including rheumatology care. Whether you are dealing with rheumatoid arthritis, psoriatic arthritis, or axial spondyloarthritis, your doctor has a goal. They have a goal for your appointment and for your condition. The goal could be to get your blood test to a certain level or to improve a certain symptom. But notice these goals are about your disease, not necessarily about you. Now, why? Because doctors are experts in the disease. You are the expert in you. You can't forget that you are the second expert in the room and need to let your doctor know what your goals are. And just like when thinking about your symptoms, being specific is best. We all want to feel better, but what does that really look like? What would you be able to do if you felt better? Sometimes it's something very tangible, like I want to be able to walk across the graduation stage, or I want to be able to take an international trip. Whatever it is, it's valid and it needs to be said out loud. Otherwise, you will end up someplace else. We can't assume that working towards your doctor's goals will happen to also get you to yours. But how can that be, Dr. Ortiz, you may ask? Aren't we all just wanting me to feel better? Of course, but let me paint you a picture. Let's say Carly has had rheumatoid arthritis for 10 years. She's had ups and downs, and although she is currently on a care plan that has her feeling better than she did in the beginning, she's had to give up her tennis, which she had been playing most of her life. She just assumed that giving up tennis was part of having rheumatoid arthritis, and she never really brought it up to her doctor. Each visit, the doctor reviewed her labs and her hands and noted that she's in, quote, low disease activity, which she assumed was a good thing, although she never really asked. Her doctor then retired, and now she has someone new. During the first visit with the new doctor, she was asked what her hobbies were, something she wasn't used to talking about in her rheumatology appointments, and before she knew it, she was crying about having to give up tennis. This led to more questions and an open conversation about her RA, her joints, and more specifically, the knee pain that ultimately led to Carly abandoning her racket. By opening up the conversation, Carly and her doctor were able to work together to build a plan that addressed both of their goals. So we've talked about the importance of setting an agenda and having goals that you speak out loud. A quick but crucial tip to getting the most out of not only your appointments, but also your clinic is to get to know the staff. Your clinic is more than just the doctor, and getting to know who else works there and what they do will help you get what you need. Every office is a little different, but key people to know are those in the front desk, those in the back, your doctor's main nurse, and any other providers that are in the clinic. You'll want to know who handles the schedule and who handles prior authorizations, as both of these people or team of people can really make your life easier. Are there ever any residents or fellows that work in the clinic? My hot tip is don't be afraid to see the trainees. They don't work alone, and after seeing you, they will run your case by the people like me, who are old, to make sure that you are always getting the best possible care. Everyone's life is full of ups and downs, and when you have a rheumatic or autoimmune condition, that journey will include a rheumatologist. This is a long-term relationship, for better or for worse, and the best chance we have at making it an effective, even fun relationship is to approach it like a true partnership. Like any long-term relationship, sometimes one person will do more of the heavy lifting than the other, which is especially true when one of the partners is ill. But we can never lose sight of the fact that there are two people involved, two partners. The decisions made in these short visits have a profound effect on your health, so it's imperative that you are involved in making the decisions. We call that shared or joint decision making, and it is a tenet of all rheumatology care. It will, of course, take time to build trust with your rheumatologist, and there are no guarantees that they will be a good fit. But by preparing for your visit, seeing yourself as the second expert in the room, and actively participating in the appointment, you will be in the best position to not only judge if this is the right partnership for you, but to find one if it isn't. Doctors speak another language, and in the hurried world of a busy clinic, they can forget to stop the doctor talk. When they are making recommendations, always repeat them back to assure that you heard it and understand correctly. I have found that this little trick helps remind the doctor that, hey, you aren't speaking to another doctor here. Talk to me like a real human. Over time, shared or joint decision making will become more natural, and you will really flow with your doctor, and that's when things get fun. This is where AbbVie's initiative, Room for Dialogue, comes in. I like to say that knowledge is power, and Room for Dialogue is a program designed for just that. Making the most of short appointments with your rheumatologist can feel like a daunting task, but it is possible, and the perks are for sure worth it. When we identify the importance of catering appointments to our needs and create productive patient-doctor relationships, we are proactive in our care while enjoying our visits. Visit roomfordialogue.abbvie to come along on this effort toward more effective appointments. A link to the website will be in the video description, and we'll see you next time.